I'm Dr. Stephen Hochschuler. I'm a spine surgeon practicing 45 years. I'm co-founder of the Texas Back Institute. I think there are many reasons that people lose balance. One is just a normal aging phenomena. Two, it could be that you had a cerebral vascular accident, a CVA. Three, it could be you have some other neurologic problem. Four, it could be you have diabetes and you don't feel the floor properly. Five, it could be you have a spinal abnormality or a hip or a knee that's throwing you off. So the question really is, are you balanced? If you have an abnormality or a complaint, an orthopedic complaint, has it affected your balance? And does surgery, and what surgery, improve balance? Texas Back Institute now, with the Gait Lab, is doing it. In the past, we as spine surgeons, we would concentrate on what we call static or still images from an X-ray to determine the balance of the spine. Did the patient have scoliosis and a curve? Did they have kyphosis or a leaning forward? Were they balanced or not balanced in their deformity or in their normal stance? And that was it. The beauty of this is that this is dynamic analysis. So in essence, what we are doing is we're living life and you're seeing how the patient functions.
Our output from this balance test can provide a lot more details to the spine clinician and physician about their patients and how they are performing, how the posture and balance is before the intervention and after intervention. We can roll out which specific muscles are being used or not being used while they're standing up during the balance test. We can also quantify how much pressure they're applying for each leg and if they have a referred side before the surgery.
If you watch the study being done, we're not just watching the gait, we're not just filming it. We're using electrodes that measure muscle and what muscle's firing and to what extent it's firing. And obviously your muscles with your bones stabilize you. So the question is, how much energy are you expending from your muscles as you walk? And what's the differential or the difference between when you have a deformity, scoliosis, where you're unbalanced and trying to balance yourself all the time, as compared to when you're corrected? Now that can have secondary effects in terms of your heart, your lungs, your metabolism, everything. So again, we're not just measuring the gait and the force on the floor and your balance, we're measuring the EMG or electrical activity of your muscles as you perform these things. So the integration of the two is paramount.
So the tests take about 30 minutes. When the first 20 minutes we just put all those sensors of them, the EMG sensor, the reflective markers, and we're testing that everything is look right on the computer. Then the balance test is similar to Romberg test, where they have them stand up straight in the natural position with the eyes open and arm to the side. During this minute we're looking how much they swing, the muscle activity, and the pressure. So the overall test duration is about 30 minutes.
So I think the first thing is to know people will have a balance study. You can do it in the gym now, just trying to get on a Bosu ball and see if you can just stand there, much less lift weights or swing a golf club. If you want a more official study, then you're going to have this kind of test that we do here. Does everybody need it? No. Everybody should have some form of balance evaluation, but this will be the best balance evaluation. So can it be done in different ways? Yes. Will it be done for other things like a total knee replacement, a total hip replacement, not just spine? It should be done pretty much for everything.